Kidney donation, transplant in general, is a feel-good story. You know, you're helping people. 99% of the time, it's always a good outcome with kidney donation and kidney transplant. There's so many tests that are done, everything's been double-checked, that the outcome is almost like guaranteed to be good. So it's very rare that you have a bad outcome. You know, people have asked what they need to do to become a donor, or what the possibilities are, and it really comes down to having a really good living donor coordinator. The coordinators run the show. They're the quarterbacks. They may not be in the limelight and be called the heroes, but realistically they're coordinating all these moving parts: the nephrologists, the surgeons, the social workers, and more importantly the patients, including the donors. Working with their schedules to try to fit in all these tests. And maybe patients look at us as the heroes, but to be honest with you, as the surgeon or the physician involved, the majority of us look at the donors and the patients, even the recipients, as the heroes. They're the ones that really, it takes a lot of courage to step up to the plate and donate an organ. It's scary to have surgery, and it's scary to have surgery to benefit someone else. So in my eyes, the patients, the donors are the real heroes. We have the luxury of participating in this and helping them achieve these goals and dreams, sort of thing. These people, these heroes that do want to donate their organ, some of them altruistically, they truly want to help someone. With the paired exchange program, if they start a chain, they're not just affecting one life, they're affecting potentially 20 different patients, are all benefiting because of their act of courage, their act of heroism. Once you start thinking about it in those terms, you can see why people go through this, because it must feel really good to have such a positive impact on so many people. Donating a kidney really has changed, especially over the past, I'd say 10 to 15 years. Obviously laparoscopic surgery and minimally invasive surgery has been around for quite some time, but it's now the gold standard for donating your kidney. And patients really are in hospital for 24 to 36 hours. It's not unheard of, but most patients are out of hospital within a day. The recovery time really has shortened down. You're back on your feet very quickly. You're missing less work. You're back to spending time with your family. So that's really kind of been the turning point for kidney donation, is that it's no longer that morbid surgery that donors used to have to go through in the past with a big flank incision, which would be a much bigger deterrent to donating an organ. I think it's a lot easier to attract people to donate a kidney if the surgery go through it is not as bad as it used to be.